Today we'd like to talk about why TMJ treatment often fails. And before we do that, we'd like to cover a little bit about what is TMJ, or some people call TMD. TMJ stands for temporomandibular joint dysfunction, and TMD for temporomandibular disorders. And it's a collection of symptoms that relate to pathology in and about the jaw joint. Some of the more common problems you get is the clicking and popping in the jaw joints. They'll often end up with a lot of headaches. You end up with tooth pains, sinus dysfunction, postnasal drip, visual disturbances, and a wide spectrum of symptoms. But the pathology that you invariably find in the vast majority of TMJ cases is that the back teeth are not developmentally long enough, leading to the jaw joint compressing up into the skull too far, making the musculature which compresses that joint work too hard, which affects the neurology, which has broad medical implications on it. On a normal joint, you'd like to see that the space in the back of the joint be twice as big as the space in the front of the joint. That's what we're typically looking for when we take x-rays. But a lot of people are born with this upper jaw just fairly pushed back. You can often feel that through the ear. You should not be able to feel your jaw joint when you put your small finger in your ear and open and close. This little cartilage, as the jaw goes back, it gets squished forward. It rotates forward like that, and then every time you go to open, it pops back into position and gets squished out of position every time you close. And that ends up causing the classic TMJ click, popping, and jaw locking symptoms. But this treatment to fix this, first off, you have to have the right understanding of the structure, anatomy, physiology, and function. And there's a number of dentists that think this is a psychosomatic disorder and treat it with biofeedback, stress management, physical therapy, and never get the structural elements corrected properly. So you have to start with the right idea that you've got to get this jaw down and forward, which means you have to put mouthpieces on those back teeth to make the back teeth taller. And when you reposition that jaw, there are primary functional criteria to determine where that jaw goes. In our office, we use speech and opening closing arc. So you'd have someone open real wide and have them bite on a stick, and as they close on that stick, the jaw will naturally go to the right position in about 90% of the cases. And that allows you to generate a bite and fabricate an appliance. Again, it must be creating space back there in that jaw joint, bringing that lower jaw forward and down in the back. And then once you do that, a lot of dentists use flat mouthpieces, and flat mouthpieces don't work. You need something that interdigitates that jaw very precisely in a forward positioning. And so it needs to have grooves on it. And so flat mouthpieces won't give the jaw enough guidance to learn to habituate forward where the joints are decompressed. A lot of dentists treating TMJ don't use different nighttime appliances. You need different nighttime appliances because when you lie down, fall asleep, go unconscious, and lose muscle tone, your jaw will displace. And that jaw falling back, recompressing again, will excite a strong neurological response that leads to a lot of symptoms. When you make these appliances and change the bite, this is a four-dimensional problem. It's off, the jaw is typically off not only vertically, laterally, front to back, but it's also off in time. That means that when you put this mouthpiece in here, wherever you put this person in time, they're going to need to be a little bit different. And typically, when you support these back teeth, the jaw down and forward, in time this jaw relaxes and wants to be down just a little bit further. And that means that you have to adjust these mouthpieces so the contact is only on the back molars. If you hit forward, if that jaw closes up and hits the front teeth first, then it has to pull the jaw back, work harder to try to get those back teeth together, and that stresses the neurological and muscular and causes recurrent pain. And again, once treatment is done, it's critical that patients have a night appliance that maintains that proper jaw position while they're asleep, because otherwise, over time, any kind of clenching, biting, postural pressures and stuff will cause those back teeth to again become re-intruded, and you end up where you started from with recurrent pain. Thank you.